Neil, can you introduce yourself for the audience?
Yeah, my name's Neil Sheth. I'm a sports physical therapist in Virginia Beach, Norfolk area. I just started a new position where I'm basically running and building out the sports program for a new ortho group here. Previously, I was in Texas where I did my sports residency and then went on to be the sports residency director and then eventually opened up my own practice. Um, and now I'm here in Virginia.
Cool, cool. So, first of all, I love your post.
I appreciate it. I try a lot. My wife gives me all the edits.
So, so I'll start with this. There's a lot of sport right now, basketball. I know basketball use it. Baseball, soccer. Like they all use I'm not gonna say every team, but a lot of teams use game day lift. So
Mhm.
can you walk us through your thoughts on game day lift?
Yeah, I mean, for, I honestly love them. When I was in Texas, I was the team physical therapist for a semi-pro team down there for a handful of years, and some of the guys would do a pregame lift, which with those we would focus mainly on a almost like a French contrast, but without the heavy load. So it'd be more plyometric, intrinsic, really just focusing on that power output to get the nervous system going, but in a non-fatiguing manner. So sets and volume or reps were kept pretty low. Some of the guys would like to lift after a practice or a game, and I mean, I'm a big fan of it. I don't know if you're familiar with Daniel Bove, but he has a book called The Quadrant System, which it makes a lot of sense to try and pair stimuluses together, right? Like a high stimulus with a high game day. And ever since I kind of got in that book and it just really connected dots for me that I didn't see before. So I really encourage it now. And even with athletes on the rehab space, um, I try and manage that when they have practice or if I know if I'm seeing them before a game or after a game, I'll manage the load in the clinic for that.
Nice. So, I also know that track athletes use the high day, high, low day, low model, kind of the same with quadra system, although quadra system, there's much more depth into that. But
Mhm.
uh, if we're gonna talk about tissue loading, like how much let's say if I squat my athlete, how much time do the muscle need to recover, and how much time does the tendon needs to recovery or the ligaments? Can we talk a little bit about this?
Yeah, I think that's a great topic because I don't think many professionals in my side on the rehab side. I mean, I do some performance stuff too, but mainly on the rehab side, I don't think enough people consider it. I mean, sometimes you'll see an athlete back-to-back days, or you'll see him 3 times a week, and if you're seeing him at that high of a frequency, it needs to be your focus for each day needs to be different, right? I mean, tissues themselves all undergo a type of active repair of fatigue damage, or basically micro tears from just your training stimulus. And those are managed and recovered by satellite cells in the tissue, right, to get back to homeostasis or build the adaptations you want. But some tissue regenerates and produces a lot faster, and then some take a little bit longer. Muscle is going to be your fastest one. That can be anywhere 24, 48 hours. Um, Typically, some people will say tendon and ligament will take about 48 on the short end, but most people kind of side on the 72-hour side. And with those, with squatting, for example, it really depends on your intent. So if you're doing a like a drop squat or a heavy load or really fast in effort load, then you have to consider the nervous system as well. And if their nervous system is fried because you've just recruited all this motor unit, then that's also in that kind of 72-hour ballpark. If you're going to try and repeat that pattern or hit a stimulus that intense again.
Cool. So, is it the same with sprinting? Because we talk like the example I brought up is squat. Is the timeline the same with sprinting?
I would think so. I mean, just because sprinting is probably one of the most or top tier athletic activities you can do, right? It requires a lot of motor patterning, a lot of output from the system. And that goes with tendons, it goes with muscle force, it goes with the nervous system firing optimally if you're going to hit high speeds. I think if you wanted to do it multiple times a week, you you would consider doing like a 90% effort, like a high load day on one, and then a sub max day where you're focusing more on the technical aspects of sprinting or plyometrics or anything in that realm. Or if you want two high days, you just spread them out enough.
Cool. So, if we consider like training load in like from a tissue loading standpoint, um, how can we like quantify like after like let's say after a sprint session, how much do we need to lift, or after like a basketball game, how much is enough, and how much is like not too much?
Yeah, I mean that's a good question. The I think what we need to consider with the athletes is then you get into like workload management, right? And how much capacity they have built in the off season to tolerate the loads of in season. And then when you're in season, it's really all about maintaining what they already have. Um, so if you have a really high frequent season, let's say it's basketball where you can play anywhere from 2 to 4 games in a week, then you might consider a microdosing aspect where you get just small volume but high effort loads after each game. Or if you have like when I was in semi-pro, when they have game day, the next day was a recovery day, and then they built up intensities in a normal, traditional, I would say, strength and conditioning program, with the highest day probably being the game was on a Saturday, it would be 2 days before. So the highest load was probably on a Wednesday, and then tapering back down.
Nice, nice. So, uh, what if like, how about like, because previously we talked about like these are all like non-injured. What if we get injured? Like, how much timeline? Like, if we pull a hamstring, like, if it's a muscle, like, how much time do we need? If it's a tendon, how much time do we need? And same as ligament.
That's the wheelhouse I work in, right? So, um, with all the tissues, I like to kind of go over that they all big picture view, they all follow a very similar healing phase, right? They all undergo that destruction, inflammatory phase, then the repair phase and the remodeling phase. And each one has like their own nuances here and there. But overall, they all kind of follow that pattern. For muscle, for example, right? When you pull a hamstring, what basically happens when you tear those fibers apart, that area fills with a blood clot and the tissue around it dies basically. And then over time, you get some swelling or local swelling there that brings in macrophages, phagocytes, all those things to kind of help clear that out and bring more healing cells to that area. And as it cleans it out, it replaces it with the scar tissue. And we're talking days to weeks right now. After the scar tissue is there, then the fibers start to connect through the scar tissue, and that's when you're going to start introducing your load because the tensile strength will kind of just be at its baseline, right? The body's just going to do enough to survive. Um, so depending on the intensity of or the grade of the hamstring pull, then if it's a grade one, I've seen people come anywhere from 2 to 4 weeks. I try to hold them a little bit longer on that 4 week side of things, just because hamstrings have that annoying tendency to feel a lot better than they actually are. But the more intense of a grade it is, right, the longer out. Now we're talking multiple weeks, months into that. Um, with tendon and ligaments, those so ligament, let's go, right? You sprain your ACL, you sprain your MCL, they'll have that repair as well. But in general, some ligaments heal, some don't. If there's a secondary injury with that ligament injury, it doesn't heal as well. In general, if ligaments do heal, it's roughly within 10 to 20% lacking of their viscoelastic properties. So that means they're not as stiff and they don't uh, tolerate force as well. So now it's a looser ligament. So it's not an optimal situation to be in if it's not surgically managed, if you can make it without surgery. Tendon, if I've seen some partial tears that have healed, right, and have gotten back to a load capacity that can go back to whatever their sport is or activity is. But both ligament, tendon, we're talking typically months on that end. If it's a full rupture, right, that's usually a surgical option, and then that's multiple months to maybe a year.
Cool. So, I think most of the strength and conditioning coaches, they're like aware of like game day lift. Like, and so and as a strength and conditioning coach myself, I'm pretty familiar with like let's say the CNS need like 72 hours to recovery, but like in terms of like all the tissue loading strategy, the timeline you mentioned, I think coaches are like not very familiar with like those concept. So can you, I know we kind of talked about it like a little bit, but can you give us a summary of like your thought process on like overall load management and tissue loading strategy?
Yeah, yeah. I'll take the football example since we kind of talked about the week layout already. So typically, game day plus one, right? So if your game was on Saturday, Sunday was more of a recovery, restore range of motion, address any niggles that may be there post game. As the team physical therapist, I would address any potential injuries that may have happened and determine the plan of care from there. Um, game day plus two, which would be Monday, that was more of an extensive type lift or session. So a little bit more long duration, ISOs, plyometrics, a little bit more volume on that day. Um, so I can't remember what Tuesday was, but I do remember Wednesday was the lift, like the heavy lift after practice. Because semi-pro we practice once or twice a week, and Wednesday was the more intense practice. So that's after that practice, that was like a heavy squat session or a deadlift session. And then game then 2 days from the game, so now Thursday, trying to bring down intensity so you can allow recovery. That can be a completely off day since you were high the day before. And then Friday, if they didn't do a pregame lift, then Friday was that kind of top off. So a little bit more intensive, but lower volume. So it's non-fatiguing. And then, right, you're hitting all your tissues there where you're extensive, you're getting some tendon, but then I don't hit that again until Friday. So that was the 3 days beyond. And then muscles, you're going to get a little bit with your mobility day on Sunday, but then you don't hit it that much until Wednesday again. And then again, right, we're in season. So the goal is really just to maintain and not try and create a surplus. It's just to make sure the athlete is healthy throughout the season because the best ability is availability in any sport.
Cool. So, uh, so can I understand the game day? Like, use basketball as an example, like can I view game day lift as because the game day there's a lot of like running, jumping, like change of direction. So there's like tendon and muscle work on that. Maybe I don't know, maybe 10 more because they're faster. So after the like the game we use like post game lift, so there's muscle and tendon on the same day. So let's say 72 hours, there's another day, there's like 72 hours of recovery. Am I correct?
I mean, perfect world, it would be like that, but that's why load management is such a thing in especially in that sport of all because of the frequency of games. Um, I know some of my friends in the NBA when they do their game day lifts, the program looks very more muscular based, right? Maybe some isometrics to help deal with any tendinopathies or aches and pains post game. I know some people use the BFR occlusion to help get that recovery and that blood flow in more while hitting the type 2 fibers. So again, a more muscular based approach post game. But but yeah, I mean the amount of contacts and change of directions, I think it hits into the thousands in an NBA game. So the amount of force that tendon goes through and cycles it goes through, it's really high. So if you've built your capacity that much over the off season to tolerate that, then you're in a really good place. But if you haven't, then I mean you're going to be at risk for some type of injury, right? Just because you're going to be outworking your capacity.
S- So, oh, so that's why they use like some sort of ISO to help like tendon like recovery from the game, like you mentioned.
Yeah, so the isometrics for tendons, you can isometrics are completed typically two ways. There's long duration ones where it's 30 seconds plus. I've seen some people do it up to 5 minutes, but that's more of a analgesic effect, right? So it just helps calm the pain down, maybe even bring some blood flow, but in a non-irritating manner. But tendons themselves, they need muscle force and load to really respond, right? Because tendons don't contract, they just transmit force from muscle to bone and vice versa. So high force, high velocity really works well with tendons. So your jumps, pogos, anything quick intensity, short duration, those will work on the tendon and help kind of realign the collagen matrix if there's any injury.
Cool. Oh, so one thing I forgot to brought up is like the bone. And we talk
Hmm.
about muscle, tendon, ligament. What about the bones?
Uh, bones are a tough one. Bones are a really tough one. Yeah, I mean, if we're talking like stress injuries or like stress fractures, those are tricky. Um, Typically they spike anywhere from 4 to 10 weeks post or into a season. I know NBA it's about 6 weeks it spikes, but the hard thing with bone injuries or stress injuries is that it lags behind pretty far, right? That's you have that 4 to 10 week lag time. Um, So those are tough. That's a really big one that if you are doing osteogenic things that promote bone density and growth are going to be really good in the off season. I actually just listened to a podcast with Rich Willian, and he recommended when people are training the off season and right before training camp or whatever sport, right, that week right before you're off. So you give that bone a time to rest, remodel, and kind of calm down or lower your overall workload.
So, like we mentioned, like from the tissue loading standpoint, like if we talk about training the bone, like how long does it or how much time does it need to like recover?
So if you're already in a point of a stress injury, a bony stress injury, then you're really going based on the bone. That you're talking weeks to months again. And if you don't address it early enough, then it's becoming a much longer thing, or it become a bigger thing where it becomes an actual fracture. and now you're looking at a surgical option again. But bone itself, if you're dealing with a stress injury, they respond really well to high force kind of functional movements. So that could be high load. So like a heavy calf raise if you're dealing with a tibia, or like a heavy squat, right? Because that muscle's pulling on the bone and creating a signal to get denser, right? Or high impact tasks like jumping. It's not the impact that's osteogenic, but it's the a force produced from the jumping. But those you have to mitigate based on where they are and how they're feeling symptom wise. Bone is interesting because kind of less than like 40 reps is the green zone. Anything more than that, they really don't respond anymore. It's just kind of hit that cap, and then everything you're doing is kind of outside the load that it's going to respond to now. So that one, monitoring how much volume you're hitting and how the athlete's responding to, that one I would say is probably the most important, because stress injuries, I think we're still, as a healthcare profession, both strength conditioning and rehab side is struggling with managing well.
Cool. So, uh, for all like the reason why I like spend like a lot of time talk about like tissue loading or like load management is because like even now we have like a lot of technology, paper, research on like injury, like preventing injury or like healing, recovery. But still, there's a lot of Achilles tendon rupture. There's still a lot of like ACL. So, like, why do you think, like, I mean, we spent tons of time, tons of money on this. Why did this still happen?
Yeah, I mean, we do spend a lot of research and money on trying to prevent them and understand them. The thing with injuries is they're just so multifactorial. There's so many things that could go into it. I mean, it would be easy if we knew, hey, this is the one thing that can cause a pain. Like old school thinking used to be a knee valgus was the only thing to cause an ACL sprain. But now we know it's some people go into knee valgus and are totally fine, right? They can tolerate that position, or that ligament can tolerate that position, or they dissipate the force well enough. They're good. That might be their position of comfort for them to produce force well. Um, but right, it could be as simple as like, oh, like they slept poorly that day, or their nutrition's been bad. But there's just so many variables that go into injuries that what we do on the musculoskeletal standpoint is the most we can do. But it sometimes you just don't know what happens and you can't control it. It's an unfortunate thing, because I think even when I graduated grad school, I think ACL re-tears were about 20 to 30%, and I'm almost 10 years out and it's still about the same. So it's unfortunate to see that it hasn't changed, but I think we're understanding how much goes into an injury is helping us to some extent.
Well, so you mentioned that you work with semi-pro before, right?
Mm-hmm.
So working with athletes, how do you like design or how do you yeah, maybe design is the right word, your movement assessment for like that particular sports.
Yeah, for football.
Yep.
Yeah. I mean, I'll kind of play with some what more of the rehab style movements, right? Just like basic like push, pull, squat, lift. I'll do some SMA stuff in there. I'll throw in. But if I'm looking at like numbers, I mean, I'll always watch the move. I'll watch how people run. Watch them how they jump. If they have any film that I could see how they play, I'd love to see it. Right? Like I had this one lacrosse player who was coming for back pain, and the way he just played was very punched over. There was no, I mean, he was a growing kid, so he didn't have enough control around his body, but still, right? I like to be able to see what people do without. That's why I like the video, because I like to see what they do without knowing that I'm gonna watch it. But when I'm doing more of a performance assessment, all right, I'll do some jump metrics, I'll do some Tindex, so I'll get some quad force output or hamstring force output, things like that. And I'll use that to kind of correlate if this athlete's more of a force dominant athlete or more elastic athlete that they need more right muscular power versus more tendon tissue I need to work on.
Cool, cool. And like, do you use like SFMA or like DNS, those like systematic like movement assessment?
I'm not familiar with DNS, but SFMA I use a little bit in my assessment for sure. Um, I do we had this kind of standard flow in our residency that we would assess athletes to joint by joint approach that I really liked and it just made sense to me. So I keep that too, and I'll throw in the SMA stuff or any more specific things as I need it.
Cool, cool. And um we talk about like football or like so it's football and lacrosse you mentioned? Oh, hockey, right? Hockey.
No, I mentioned lacrosse. Yeah, yeah, I had a lacrosse
Oh,
kid who
sorry, sorry.
was with
Yeah,
back pain. Yeah, yeah, yeah.
yeah. So how about like basketball? Because I work with basketball more.
Mhm.
How would you like say design the same movement assessment for basketball?
Yeah, I mean, most of those injuries are low back and lower, right? Like very rarely do you have an athlete dealing with any shoulder issues or coming to me for an injury. So with that, I like to see kind of how much rotation they have in their back, how much extension flexion, how they get into a squat. With jumping, right? Most people will be either like a hinge dominant jumper or a knee dominant jumper. So seeing what that looks like for them as far as jumping goes. And then now that I have force plates, I'm able to get a little bit more data as to how they're producing this force, how they're accepting the force. Um, and another big one is ankle mobility. Some of these basketball guys have terrible ankle mobility. It's almost as bad as mine. But they're still really high level athletes. They still dunk on anyone. But just seeing what little things you can address, maybe that 1% is helpful.
Yeah,
Hopefully
so
that answer. I don't know, I think I feel like I strayed away from the question.
no, 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 it's good. It's good. I like it. So for like yeah, yeah, terrible ankle mobility. Had to do so their ankle mobility is like way like yeah, awful. And that's probably affect how they land, how they hinge, how they squat. And so it's crazy that with that ankle they have to jump that much, they have to sprint that much. So besides like besides like molding their ankle, is there any like way to like increase their like mobility?
I mean, yeah, it's tough because it takes a lot of effort and a lot of time to do. Stretching, you might get some series elastic components to grow, right? But that's I think the minimum is like 2 minutes a day, every day, or multiple times a day, for that to happen. And I don't even know when the turnover where you start to see that is. Um, you could do right some ankle mobs to affect the joint, but if the joint itself isn't stiff, I don't personally see a reason in doing it. If it's the muscular component, the tendon component that's limiting the dorsiflexion, then that's what we need to address. Um, there are some neural components to it too, right? The nerve mobility may not be there, so addressing that may help as well without even touching the other ones.
Cool.
But those are some options.
Nice, nice. So uh I'm gonna jump in the next part of the podcast. I want to ask like nowadays like coaches, strength coaches, there's a lot, I'll say this, there's a lot of strength coaches have like PT background or DPT. background, and there's a lot of like PT. They know more than just movement assessment. A lot like have like athletic training background. So, uh, you work with sports before, you work with strength coaches before. Like, let's say if I'm a strength coach, I want to learn more about like physical therapists. What are some things that you think that is like young strength coaches should learn that it'll help them like try to like minimize the gap between like training and rehab?
Yeah, that's a really good question because I've been in some positions where I'm both the physical therapist and the performance coach. I've been in positions where I stick purely to PT and I hand off to the strength and conditioning coach, or we work together. Right, there's that gray area. But what I mean, I think it kind of goes back to that tissue loading and understanding. Hey, this is what we're doing and why we're doing it, and this is the if they can see what the progression is or what it's supposed to be and where they can kind of add whatever's uniquely their own, sure, I'm all for it. I don't really like having like a cookie cutter approach or like it has to be this, it has to be that. But pattern wise, hey, I need you to hit this or I'm gonna hit this, you can do whatever. Um, but yeah, understanding that tissue loading and that progression of how it's what we're doing now is going to get them to sprinting or jumping again without issue and how you can help facilitate that. I think that would be the biggest thing. Just
Cool.
know that we have a plan as well as you, and we want us to all work together.
Cool. Because currently I'm like interning at a physical therapist clinic. I'm a strength coach. I'm interning at a physical therapist
Yeah,
clinic,
nice.
trying to like learn movement assessment, trying to learn like loading strategy, like tissue recovery, all those stuff. I mean, I'm very familiar with like the SFMA approach, joint by joint approach, like like static movement assessment and then break it down the table. But like
Mhm.
really, when I really like put myself into like another environment, like pure injury or like pain and recovery from it's different. Like how like the motor control part is really interesting.
Yeah, trying to teach someone a different pattern that they've never had. It's especially when I was doing with the kids, it's wild. It's the ways they learn things and how some kids pick it up and some kids don't. It's there's so many ways to like skin a cat.
Yeah. So I'll ask you this. So what are like the next like maybe the next topic you want to dive into, want to explore?
Like me personally
Yeah.
in my career,
Yeah.
yeah. So right now it's that I have the force plates now, which are an amazing tool, right? So much data, but I mean, how much is that data actually useful, right? All these numbers are there, but there have been some exercises that I have played around with, like drop catch variations or things with accommodating resistance that I've used with the thought, hey, this one's going to be more of an eccentric bias, or I'm going to get a little bit more tissue loading here. That now I can actually test it and see if I was just spitting crap or there was actually a method to the madness. So I think diving into the actual sports science side of things.
Cool. It's interesting to see that our field like trending more into like everybody have like dual credential, like coaches
Mhm.
learning more sports science learning more about like coaching, physical therapists learn more about coaching, sports science. It's really interesting.
Yeah, I mean, I think it's honestly really good because it helps us understand each other better because we're speaking the same language to an extent. And then, I mean, if we're on a team, our goal is to help the athlete compete and the team win, right? There shouldn't be an ego thing. We should all understand we're trying to help each other advance the same goal. But yeah, good for you interning at that PT spot. Hopefully, you're learning a lot. I will say here, um, a large majority, and this has been a thing for the past few years, that just PTs don't understand loading programs and how to progress it. And it's just very cookie cutter and basic as much as we think it's individualized and very unique and special. It's really not. But I think that's something you could probably teach whoever you're working with.
Yeah, man. And I also work with some therapists that like they only work with athletes or they're in their clinic. They never really watch how they move, how they sprint, they jump. And when they exposed to like the movement they're doing on court, they're like amazed. So I actually appreciate that you say like you watch the film that they do on the field, running, change of direction, the movement strategy. That's awesome.
Yeah, I appreciate it. I mean, if I could see what they're really good at and maybe what is lacking, then I kind of have a better understanding of how this program needs to go.
Yeah. So I think that's all I have for today. So for those who are interested in what we're talking about today, like tissue loading, recovery timeline, game day lift, where can they reach out to you? And those posts you post on Instagram and LinkedIn, like those are amazing. Where can they find those?
Oh, I really appreciate that. I usually sometimes I think I'm talking into the void. So glad you like it. But the best way to get in contact with me is probably Instagram. It's N1, the letter N and the number one sports rehab. And then if they want to add me on LinkedIn and send me a message, I'm all for that too, which my name is Neil Sheth, and I'm sure you'll put my name in the notes. So those are the two best ways.
Yeah, gotcha.